My name is Dr. Suelyn Lai-Smith and I'm an obstetrician and gynecologist in private practice. I have been working as an obstetrician since 2021. I love private obstetrics as I get to journey with families from the very beginning of their pregnancy until after their babies are born. It is a specialty filled with so much joy and love and an absolute privilege to be a part of. Cord blood banking is a process of collecting and storing the blood that is left in the umbilical cord after a baby is born. It is rich in stem cells and can be used in the treatment of medical conditions such as blood cancers, immune conditions, and metabolic disorders. Conditions where stem cells are currently used include different leukemias, lymphoma, and high-risk solid tumours. Cord blood is also being used in clinical trials researching conditions such as type 1 diabetes, cerebral palsy, and spinal cord injuries, just to name a few. Cord tissue is a segment of the umbilical cord that has different stem cells to cord blood. Mesenchymal stem cells collected from cord tissue are multipotent, meaning they can regenerate and differentiate into many different types of cells, including cartilage, bone, fat, and muscle. As of 2025, there are currently 40 studies investigating the role of these cord tissue stem cells in a wide variety of conditions, including stroke, Parkinson's disease, multiple sclerosis, osteoarthritis, asthma, burns, and cerebral palsy. The benefit of private stem cell storage is that doctors don't need to look on the public registry if a stem cell match is needed in the future. If the stem cells are needed for an approved therapeutic use, Cellcare does not charge for their release and will send them by a medical courier free of charge anywhere in the world. Worldwide, cord blood has now been used in over 45,000 transplants in the treatment of over 80 different conditions. The collected stem cells are a perfect match for the baby. There is also a high chance of matching biological siblings and, excitingly, potential for use with other family members as well. Most importantly, these stem cells are stored only for your family's private use. Delayed cord clamping and cord blood banking can be achieved, however there is a compromise on both sides with regards to the volumes obtained for both. In consultation with your healthcare provider and Cellcare, a good collection may still be possible along with delayed cord clamping. The process is really straightforward. Simply enroll online with Cellcare and a collection kit will then be sent to the mother. She will then take the collection kit with her to the hospital at the time of birth, and either her obstetrician or a Cellcare collector will do the collection. This kit is then transported back to Cellcare's lab where it is processed and stored. 18 years ago, when I banked my first child's cord blood, I knew that there was a use for stem cells in leukemia treatment. Given my children's unique genetic background, being a combination of Chinese, English, and Scottish, I knew that if they ever needed stem cells, it could be quite difficult to find a match for them with their genetics. I approached the decision of storing my children's cord blood like taking out life insurance or health insurance. I hoped that neither of my children would need to use the stem cells, but if they did, then it would be there for them. I also knew that as medical science and research evolves, there would be more uses for this medical technology in so many different areas going forward. If you have the financial means to store your children's cord blood and tissue, then it is a gift you are giving them for the next 20+ years that could be a potentially life-changing decision. Parents also only have one opportunity to collect and store their baby's cord blood stem cells at birth. It is a unique opportunity that will never arise again. So make sure you do your research, talk to your obstetrician, contact Cellcare, or sign up for the information webinars where you can find out more. One of the wonderful things about being an obstetrician is being supportive and being able to provide the most up-to-date information for our patients. The area of stem cell storage and research is always evolving, so it is important to talk to your obstetrician and get the most up-to-date information so you can make the most informed decision.